Community pharmacists can help with older adult fall prevention. They can screen older adults who are at increased risk for falls. They can identify medications that place patients at higher risk for falls, and then they can make medication recommendations that will lower that patient's falls risk. Patients typically use a pharmacy that's convenient for them. They usually get all their medications in one location because it's a convenience factor, and we have the advantage as pharmacists to see all the medications that a patient is on. There are certain medications that place patients at high risk for falls. These are classified as high-risk medications. They might have more side effects that might lead to dizziness. They might impair your ability to react, your reaction time, and those medications also put you at increased risk for falls. So every time I see a patient who's 65 and older come into the pharmacy taking 4 or more medicines, a light goes off in my head that I need to start screening these patients to see if they're at high risk for falls. We use the 3 questions from the STEADI initiative, which can be asked by anyone. That information is then shared with the pharmacist. And then the pharmacist does a comprehensive medication review. If they identify a medication-related issue that is pertinent to that patient, they'll have a conversation with the patient about are they ready to change. They'll educate the patient on the risk related to falls and how that medication could increase that patient's risk for falls. And if the patient has buy-in and wants to change the medications, that information will be shared with the patient's primary care provider. Pharmacists have a fantastic opportunity every time a patient walks into the pharmacy that they can have a conversation with patients and what's happening in their life, what's going on, how are the medications affecting them, how is their gait, how are they walking. So the conversations that community pharmacists have with their patients are rich and full of information. They can take the information that they learn from that conversation then to further educate the patient on what are some other risk factors and what are ways that they can reduce their risk for falls. And through that education, that can prompt the patient then to go have further conversations with other members of the healthcare provider team. So UNC and CDC have partnered to develop tools for community pharmacies that will help with screening. So how to incorporate the 3 STEADI screening questions within the community pharmacies within their workflow. We also have developed tools regarding medication and medication reviews and how do you write your medication reviews if you identify a high-risk medication for an older adult. We also identified tools for how do you communicate that information to the primary care provider offices so that that information can be shared and you can coordinate care with that patient's primary care provider.